Hello, friends. Welcome back. My name is Michael Yates. This is Ridgeview's video podcast where we try to cover everything hope, healing, and recovery related. We're pleased that you've joined us once again for our weekly episode. As always, we like to give out our helpline number, which is 833-503-0348. That is available through the end of June, at which time that particular helpline will come to an end, which may be good news for everybody. But it is available from 8 a.m. to 8 p.m. Monday through Sunday. Yes, including Sunday. So if you know of someone who may be in need of talking with someone else, trained counselors are available. Give them a call. Part of this video podcast is part of our COVID response effort. And I am tickled to have Laura Connor with me today. So it's always really cool when we can have guests come in from outside Ridgeview or our programs and services. And gosh, having someone who's a county director of both the health department in Roane County and Morgan County, what a rich opportunity this is. So I'm really pleased you're here.
Well, thanks. We appreciate the opportunity to come and talk about what we've been up to lately.
Yes, well, please do. I mean, as we are recording this, some new information has come out regarding vaccination. So, yeah, I mean, just give me a snapshot of where the two health departments are in what they're providing most of. Is it a combination of testing and vaccination? Is it mostly vaccination now? What's going on?
We are still doing both. Our testing has been curtailed a little bit so that we could focus more on vaccinating people, but we still do offer our staff collected swabs samples on Tuesdays and Thursdays. And we have Everlywell self-test available on other days. So if somebody still wants a test and has, means, ability, interest in doing a self-collection, we offer those. So testing is still available every day. But like we said, we are really focused on trying to get vaccines out to as many folks as possible, as quickly as possible.
Yeah.
So that has been our primary focus over the last, I guess, since about the end of last year.
Yeah. Now, are people primarily driving to the health department location, or are you guys still going out to communities?
A little bit of both.
Okay.
As the demand has dwindled a little bit over time, we now have the ability to travel, take our show on the road,
Nice.
and go to where people are. And we know that, transportation is such an issue for a lot of people. And, they may be interested in coming in to be vaccinated, but don't have a ride to get there. So now we have the ability to go out to folks. We're, looking at going into businesses who are interested. We've been to housing areas. We've been, just festivals, community events, basically anywhere that'll let us set up a tent.
Yeah,
we
neat,
can go.
neat. And
Yeah.
the vaccine that you guys are primarily administering is the Pfizer.
It
that
is.
right? So as we're recording this, we were kind of chuckling before we started about the new announcement that came out from the CDC and the White House about if you've been fully vaccinated, you this category of people can no longer have to worry about wearing a mask. So of course I was skipping on my way in today, thinking that, well, of course that applies to me, only to learn, yeah, but there may be exceptions to the rule. So I was so looking forward to taking this and having a funeral pyre for it. But it sounds
I
like
think that we're all looking forward to that day beyond a shadow of a doubt.
I've got these little calluses that have developed right behind my earlobe.
Yeah.
So yes, healthcare agencies, hospitals, health departments, we may still have an obligation to wear those, but it was a promising sort of like light at,
A little bit of light at the end of the
yeah,
tunnel now, but we do still, if somebody finds themselves in a high risk situation, or they are close to people who may be at higher risk to develop the severe complications from a COVID infection. If you feel more comfortable in wearing a mask, we would encourage you to continue to do so, or just to give that extra protection. So
yeah,
we want people to still feel empowered and enabled to continue to
yeah,
do that if they want
yeah.
to.
So I know that because Ridgeview's begun to have conversations with Covenant, we joined together in doing our every 3-year health
Hmm.
assessment, community health assessment. So I think health departments do that as
We
well.
are. Hmm.
Every health assessment, I suspect, is going to be against the canvas of COVID. Like everything is going to somehow
Hmm.
be related to that.
Yeah.
What, how does that look for health departments? Do you guys do it every 3 years or every year?
About there's some piece of it that we will revisit typically on an annual basis, just as we develop our own internal plans for things that we want to do in the community. So we look at data, we look at needs assessments and things like
Yeah,
that to kind of help inform those things. I think one thing that has been particularly helpful through COVID is in looking at the assessments that we've done in the past, it's helped us to be in tune to some areas of particular vulnerability. Like we know, substance use is such an issue in all of our communities. We've seen very high suicide rates, in a lot of our communities. So to really, and we know the mental health toll that, we saw before has only been exacerbated by, you know, things that COVID has brought along. So it's helped to really be in tune to some of those additional needs outside
yeah.
of the regular preventive and
Well,
um,
several of the earlier guests today, as we were recording for the next month's episodes, one was from Tennessee
mhm.
Suicide Prevention Network. Another was about substance use disorders. So yes, yeah, it'll be very interesting if some other themes emerge, like um, uh, things related to trauma,
Mhm.
or like a chronic trauma impact that folks, as we kind of come out, but this growing sense of languishing that
Mhm.
people have. So,
A lot of anxiety in
yes,
going back to the way things were before, and um, you know feeling of
yeah,
isolation.
yeah. So I always, somewhere I learned, seek first to understand before being understood.
Hmm.
It's always served me well. I believe it was St. Francis that maybe first coined that. Uh, but so for people who may be leery of a vaccination,
Hmm.
for whatever reason, are there uh, are there pearls of advice, counsel that you would suggest that could help their discernment on to
Sure.
get vaccinated or
Um,
not?
Yeah, we know, there's typically about three different groups of folks when it comes to vaccinations. It's those people who are gung ho, want to be first in line, ready to go. And then we know that there is a pretty significant group that are hesitant. Um, and then, there's the third group is the people who just are not interested at all. So, for those folks who are hesitant, and even for folks who aren't interested, one of the things that we want to really stress to everybody is the vaccine is very safe. It's very effective. Um, it has a very, very robust safety um, study plan. Everything that gets reported, they look at. We had the pause there with the Johnson & Johnson vaccine a few weeks ago, and that was all part of that safety mechanism. To if something's identified, you stop, you take a look, you evaluate, and see if any changes or alterations are made. People have expressed a lot of mistrust or uncertainty about the new vaccine technology with the Pfizer and Moderna vaccine, it being a messenger RNA type vaccine. But, and they have worries that those clinical trials passed so quickly. And they did go quickly, but, there weren't shortcuts made. They changed up the process a little bit where different phases were happening at the same time instead of one phase and then it comes to an end, then you start the next. And then, those messenger RNA, the technology behind those has been in development for a while. So it's not a brand new technology, just the first one authorized for use. So that's been coming for a while. But, like we suggest with all of our vaccines, it really is for your health and safety, for the health and safety of your family, for the ones that you love, for your community. And it is really a great service that you can do for those people that you love and the people that you live around and work around and worship around and play around.
Yeah,
So.
well, no, that's great advice. I think it's important just so we recognize that there are folks that are reticent
Sure.
for a variety of reasons, and so any information we can get out there would be helpful.
And, we do always also recommend that people be cautious about their sources of information. You can find everything under the sun on the internet, and some of it may be good information and some of it may be not so good information. So, just be cautious in your sources.
Yeah.
And
That too is a topic we covered earlier today as well. Social media and internet, and that's sage advice there. So I had the good fortune of being invited to present on coping with COVID. It was early summer of maybe it was about this time last year, somewhere in there. And I, to this day, still remember one of the nurses, I believe it was a nurse in the Roane County Health Department. We were talking about guilt. And what struck me was she said, "That's me. I feel guilty right now." And I said, "Tell me more about what?" And she said that I have a job. And so that has stuck with me all this time. How everyone in the community turned to each health department for stability, for clarity, for help. Your folks have worked so hard throughout an incredibly hard year. How are they doing? Just tell me, how are they doing?
It's been a tough couple of years. So we really, in leadership teams in both my counties, we really do try and stress the importance of self-care and finding an outlet to be able to help with the coping, with the compassion fatigue, with just being on all the time, because people have questions. They had questions, they had needs that needed to be addressed, that needed to be met. So, for months we would work 7 days a week, all hours of the day and night, and so really trying to bring folks like your program in, which we still talk about to this day, trying to bring those resources in so that people feel okay, they have somebody to talk to when they need to. We have our EAP programs and recommend people take advantage of those as needed, and try and rely and be a support to each other. But it's hard.
Yeah.
I'm a great preacher of self-care, but I struggle.
Yeah.
It's not always easy to put it into practice.
Yeah.
So
All that stuff, it really sounds great theoretically, academically, all that stuff. And I like you. I mean, I'm, oh yeah, but it is
When that phone rings, you still need to answer it.
integrating it into real practice is difficult,
Hmm.
especially when you are in healthcare fields. And, like you, we never closed down, but I know the health departments were turned to for answers
Hmm.
for a lot of health related stuff.
When
Certainly,
there sometimes weren't answers to
yeah,
give.
yes, yeah. So, yeah, I mean, well, let me take it one step further to personalize it further. Uh, what do you do to take care of yourself?
Um, try and incorporate mindfulness in, as much as I can whenever I start to, feel things creep up, just try and take a time out and be aware of those things and take a step back or a time out, when I need to. Um, try and connect with family, with friends, or um, just go sit in the dark for a minute, or
Yeah.
wherever you can find just that little bit of refuge
Yeah.
to
No, so,
recollect.
I mean, that's beautifully said. Someone earlier today talked about finding that uh, where mindfulness and stillness sort of
Mm,
coincide. And she referenced, I'll even drive to a parking lot and just turn everything off and
yeah,
just be
be
still.
just be.
Right. So I'm like, yeah, I mean, that's, uh, so I know we all tried to look into our crystal balls throughout
Wish I had one.
2020. Yes, it's going to end here, it's going to end there. I don't I know that you don't have a crystal ball, but I guess as you do think of the future through the rest of 21,
Mhm.
I mean, what does that bring to you?
I think we're seeing a lot of positive trends with COVID, and hopefully, as we continue to go forward, we'll see less and less of it. We're already seeing, a more of an increase in our traditional public health services, all the things that we did before. So, we're glad to kind of we've kind of all laughed that we would probably all have to be retrained in our previous jobs because it's been so long. The focus has been on COVID so much, but we are coming back to a lot of that. So, we have a lot of hope that things are going to return to the way they were, and we'll be better prepared for. There's an awful lot of lessons learned through all of this that we'll be able to carry forward and incorporate into, day to day. I think everybody's seen where there's had to be such change in the ways that we operate. Um, and, we get stuck, we do the same things all the time because that's the way we've always done it. But I think one of the positive things that has come from this is it's opened our eyes that there's more than one way to do something. So I think that opens up some opportunities for us for, going forward too.
Wow. Well, you've mentioned three words there that jump out at me: positive, hope, and opportunities. So that I cannot imagine a better three words to conclude this conversation. So uh, it makes me feel better just hearing those words. So okay, if someone is watching, listening to this, and they want to reach out to the health department
Hmm.
in Morgan or Roane,
Hmm.
they can certainly search. We'll put the links in the
Okay.
comment section, but they can begin to access the traditional health
Hmm.
department
Yeah.
services.
And we have continued to offer those, but it's been in a very altered way, and some things have been scaled back. But
Yeah.
we're ramping all those things up, and be glad to people can call. If somebody is still interested in a vaccine. In the beginning, we didn't require it, or did require appointments for those, but now, we have just walk-in drive-up hours that people don't have to go through that computer system to schedule those. So, yeah, any questions, any needs, we'll be glad to to do what we
Fantastic.
can.
Well, thank you
You're
for
very
everything
welcome.
that you guys have done for your team, both of your teams. I still think about what the wealth of stuff I got from just being with your people. There, I admire their dedication, their calling to service. It's We don't recognize it enough. So keep up the great work, and
Thank you.
please
We
keep
appreciate
taking.
your partnership
Yeah.
and what you all have brought to the table and into the community as well.
Well, thank you. Hope you'll come back someday.
Anytime.
All right. And thank you for tuning in, folks. It's always great to have you. Please don't forget to subscribe or ring the bell so that you stay abreast of our latest weekly episode. Take good care of yourself, and we'll see you next week.